welcome to Therapy Unlocked, where we discuss all things therapy from an unlocked perspective. I'm Emily Huffman, and I'm here with Katrina.
Hello, Katrina, Mondragon, licensed professional counselor. I am a professional, but not your professional, so nothing we're going to talk about today should be taken as medical, legal, or otherwise advice. This podcast is purely for education and amusement. That is it. That's the disclaimer.
Education, amusement, and because I would like to be famous. So please like, subscribe, follow, engage, and welcome to Therapy Unlocked. I was healthier at 287 pounds than I am today at 152.
It's in blood work. If you haven't had blood work lately, go to the doctor and have labs done.
Yeah.
And if they tell you no, ask them to write it down.
Oh, yeah. This is a recurring theme. Ask them to write it down. Make them write it down. Remember, kiddies, you are the boss of your medical care because you are the boss of your body. And if anybody says you aren't the boss of your body, then they're the wrong person to talk to. Okay? You're the boss of your body. Now, I'm not trying to empower people to bully medical professionals. Be kind. Always be kind.
Work with them.
Always be appropriate. Let them know you are glad they're on your team. And as your team member, you know that they want you to receive the best care possible and feel better as soon as possible. So if there is some verifiable reason why you should not have whatever testing or medication, then it should be no problem for them to write it down in your chart. And a lot of the time they change their mind, all of a sudden you got to go get that testing done.
It's funny. I used to have white coat syndrome. I don't know if you know what that is.
Mm-hmm.
And I've overcome that through exposure.
Explain it for the...
White coat syndrome, for those of you who don't know, is when you go to the doctor and your blood pressure goes up. And they're like, do you have hypertension or are you nervous to be here? And I say, I'm just nervous to be here. And my blood pressure no longer goes up. When I go to the doctor, my blood pressure is almost like that 120/80. Never exact, but it's around there.
Yeah.
And that they say that people who have a high blood pressure, when they go to the doctor, go ahead and measure it when you're at home.
Mm-hmm.
And that's what I did. I measured it when I was at home 2 times a day for like 2 weeks. No hypertension. I had white coat syndrome. I faced my fear. And then slowly, I no longer fear them. I still fear the dentist, but I really like your TikTok on the dentist. We'll link it in the comments. She makes this TikTok where she says, tell them to treat you like a child at the dentist if you have anxiety. And I do this. I tell them,
I do too.
I have my earbuds. I have a driver and I have to be treated like a child, if you don't mind. And they are like, no problem. Let me squirt you with the air. And then I giggle.
I got bubblegum flavored toothpaste. I straight up told, I told the woman cleaning my teeth that I did not know how to brush them. And I'm not ashamed of that. Okay. I grew up lower income. I grew up on a farm. I'm not laying any blame anywhere, but for whatever reason, I did not appropriately learn oral hygiene. So I learned so much more because, and the way that I found out I didn't know is because I accompanied my children to a back to school backpack event and Mr. Tooth was teaching them how to floss. And I was like, say what? That's not how I floss. No, we were doing a back and forth thing. Now there's like a loop and a pull situation. I didn't know that. No one told me that. I went to the dentist and I didn't tell them to treat me like a big old child and no one told me that. My teeth are so much better now because I know how to floss. I know how to brush. I know how to pick a toothbrush. Nobody tells you those things when you are millennial age and over, right? Because we were just told to like get out of the house until dinner time. Like, period. There was no oral hygiene discussion.
Come on, you come inside.
And get on the computer and have unchecked internet time, kids. Bye. It just, whatever. No, when I go to the dentist, both emotionally, I need to be treated like a child because I have anxiety out the wazoo, and I need to be told like a child how to take care of things. And honestly, I recommend that for medical appointments too.
I also think grounding really comes into play when you're in a chair and like really you could hurt them. Like if you just whack your arm up, you could smack them in the head. Don't do that. But ground yourself. 5 things you can see, 4 things you can touch but don't touch, 3 things you can hear, even if it's somebody in the next room, 2 things you can smell or think of to smell, and 1 thing you can taste or imagine to taste. And I do that twice and then I'm back in my body.
I love that one. Another one just like that I use, and grounding, yes. More often I will use it if I'm like in like a panic of some kind. I'm panicking about something. or like I'm stuck in just rumination, I'm catastrophizing, everything's going to go wrong, I will start trying to name every street I've ever lived on. And if that one exhausts me, then I'll try to name every breed of dog that I can come up with.
Categories.
Or, yes,
I remember
categories.
You taught me categories
did.
before I was ever a full-grown clinician.
Mm-hmm. Yeah. Well, you know what? It's a coping mechanism I developed as a child.
I use it at work.
And it does not get old. You can keep doing it forever.
And it doesn't have to be dogs. It can be cars. It can be brands. It can be celebrities. It can be...
If a loved one is freaking out and you happen to know, I don't know, that they're like a big fan of the WWE, be like, list all the WWE superstars.
Go.
Oh, Damian Priest, LA Knight, CM Punk, Seth Rollins. I mean, no, there's too many.
There's too many.
I could go forever. But that said, Liv Morgan.
Didn't CM Punk fight one of the the UFC fighters?
Yes.
Who did he fight?
Yes. Oh, okay. I don't remember who he fought, but I know it didn't go well for Phil. Phil had a hard time during his brief stint in the UFC. He was not intended to be a UFC fighter. He might have fought McGregor. I don't remember. But that said, he is best in the world for WWE, save Seth Rollins, who is better than him. Okay, no arguments. No arguments. Okay, some arguments. You can argue if you want, but you're wrong.
In the comments.
That said, though, getting back on topic here with the, I want to know what you think about. So, as you were saying, grounding in medical scenarios to help you get that blood pressure down before you advocate for yourself. You know, in that line that we were on, what I now realize may have been me putting myself to sleep. But what I previously felt was me intentionally dissociating. So that is going to take some thought process on my part. We're all processing this thought at the same time right here. But because of my chronic pain and my excessive pain, a focus of mine in therapy was to try to reach that checked out space where I am conscious, but not all there, right? Similar to, I believe we equated it at the time to like a CIA operative getting tortured. How are we going to disconnect ourselves from this physical feeling that we're having right now?
To be the observer of what's going on rather than the... Okay.
So that's when I started to really get into ACT theories and things like that.
Acceptance and commitment therapy. Which I'm still a big fan of. But during that period of time and that idea of trying to become an observer, I locked into the idea that, okay, if it's bad enough, if I popped my shoulder out, if I whatever, then I will check out mentally as a coping mechanism on purpose. Now, I am now aware that that is probably me putting myself to sleep. I'll have to dig into that. Are you experiencing an intense emotion when you do that?
Pain. Pain is always an intense emotion. So it could also be cataplexy, yes. Like just the, you know, but they're kind of, they're tied.
Have you ever heard pain plus resistance, or pain times resistant, however you want to math it, equals suffering?
No.
Yeah, they say pain times resistance equals suffering.
Interesting.
So if I break my leg and then I'm like, my leg hurts, it really hurts, I can't do this, I can't do that, and wallow. So then I've now hurt my leg and I'm in pain, and then I'm adding the wallowing, and I shouldn't have broken my leg, and I was stupid for jumping off that cliff. Whatever the judgment and negativity is, that is the resistance. And then one suffers. They sit there for weeks on end suffering with that broken leg,
right?
Versus somebody who's just in pain. I have a broken leg, I'll be better in 6 weeks. Or whatever the healing
one
time
of the most important things I ever learned regarding pain had nothing to do with me being in pain and everything to do with my child. And I often say my children saved my life and my mental health and everything else. And they did. When I was pregnant with my son, my very first kid, I went to a birth class and we talked about pain during birth. And the instructor said that verifiably, scientifically, they had found that breathing alleviated pain as much as taking a Tylenol or an ibuprofen. Right.
That's a physiological sigh. 2 inhales, 1 long exhale. And I understand they do that for pregnant people.
There's more than one pattern of breath that one can choose. Personally, I have found that you don't necessarily have to even stick to a...
But what is the pregnant people breath called? There's a word for
Lamaze.
it. Thank you.
Lamaze breathing. So Lamaze breathing is the method of breathing for pain management during giving birth. So I learned about Lamaze breathing in that birth class. I learned about breathing for pain relief. And as it carried on into my life, as I subluxed muscles or I had the extreme back pain or the various things that have occurred, I have locked back to that thought that I can alleviate a considerable amount of this pain if I breathe right now. If I breathe right now, I can alleviate a considerable amount of that pain. And it's entirely true. And that would be an acceptance because you have to calm down and breathe in a patterned fashion. And I would even say I twisted my ankle once so significantly, I had to have a boot. And after I twisted my ankle, I immediately went and didn't stop. And we continued on that way. And I was okay until I got medical care and I got what I needed. So I think that's accurate. I do. Yeah. Now there's other pains that you can't breathe all day and all night for a month.
I used to live at an 8 if we're looking at the scale pain, the pain scale of 1 to 10. And then after I got my back surgery, that 8 went to like a 4. And then now it's like a 2. But like, it was wonderful to have that relief from getting my SI joints fused. But like I had a point and I lost it. It just went poof.
That's okay, because I'll interject. The chronic pain scale needs to be altered. What it currently is does not make any sense to me as somebody who considers, you just use the numbers. I don't believe in the numbers. The numbers don't work for me. The way that I have to approach it as a person with chronic pain, tolerable is 0. From 0 up is how I rate it for a doctor or medical professional. So I am in pain. I am in significant pain for me right now, but it's maybe a 2. To someone else, it would be an 11. They'd be at the hospital.
Subjective.
It is extremely subjective. But if you are someone who takes things very rigidly or like a rigid thinker, as I often identify myself, when they ask you that question for the first 10, 15 years of being a chronically ill person, I tried to answer, well, I'm always hurting. Well, I tried to answer and it ended up in unnecessary confusion. I think it would have been so much better had they said, okay, I understand you regularly have pain or you are a chronic pain patient. Start your metric at 0 and tell me where you are. Like, because there really isn't much way around it. The other one that I really like
would 0 be though? Because the normal amount of pain I learned is like no pain.
Tolerable.
But the normal, like using air quotes, because normal is totally subjective. But the quote unquote normal amount of pain that people experience is none.
Correct. So normal pain, a normal amount of pain is no pain. I was shocked when I found that out.
1 to 3
I had no
is
idea.
like mild. 4 to 6 is moderate. 7 to 9 is extreme. And 10 is
So I like the chronic pain scale where it's like, I won't even start at 0. I can't remember what 0 was, but somewhere it's like other people would go to the hospital. And then the next one up is like, I am really not feeling good right now. And then the next one up from that is bees. And then the next one up from that is bees.
So I wonder what your, this is maybe another topic. Have you ever heard of solution-focused brief therapy?
Yes.
Do you know that that scale of 1 to 10 is used every single session?
Uh-huh.
Okay. What do you think of that?
I don't like it.
Interesting.
I don't like it. I think that it has had a negative effect on, much as I said earlier, I think that we need to throw trauma out. We need to throw trauma out.
What does the scale have to do with trauma?
I would never have ended up in therapy.
Oh.
But then I would go in, and I've had this with more than one clinician, not just solution-based therapy, but you go into the scenario and they say, how do you feel today on a 1 to a 10? I am a chronically ill person in a lot of pain. most often that answer was influenced by my physical health and not my mental
I
health.
never really asked people, how do you feel today?
Good.
Okay, good.
I think that's very valid.
I asked people, what do you think would be most helpful for us to talk about today?
More often than not, my therapy, until I found a more productive therapist, and really the way that went for me was getting so frustrated that I, from right off the gate, told them, hey, I have a lot of physical health problems. That isn't why I'm here. I don't want to talk about that. In fact, I had one therapist who, through no fault of their own, had to leave our therapeutic relationship because they had gotten like another job or promotion, something like that. And I had only seen them 4 times. And at each one of those appointments, I had simply been teaching them about my illness.
Oh, that's got to be frustrating. No.
It's exhausting. I don't recommend it. I think a lot of people feel like it is a way of showing compassion, or it's something that
But a therapist's
they want to
curiosity
talk
is
about.
not why you're there.
Right. I feel, in my analysis of the scenario, and I feel like I'm pretty self-aware, I feel like it was more of an attempt at being compassionate, to be like, why don't you tell me about, these health problems and how they're affecting you? And ultimately, I should have just walked in there and said, there's always a shark biting my head. Okay, let's go from there. Like, there's always a shark biting my head. Okay, whatever you want to put into that, I can't see, it hurts, I'm confused, I'm scared, I don't like it. But that shark biting my head does not solve my marital problems or teach me to be a better parent or help me.
Did therapist ever ask you the question, like, are you satisfied with how you responded to XYZ, whether it was a thought, behavior, or emotion?
Of course.
Good.
Yes.
That's a standard question.
Yes, absolutely. Yeah. No, I've been asked that before. And as I'm apt to say, I am not saying I'm without mental health problems. I have them. I ruminate all over the place. I am one cool dude. And all of those things said, there are some other issues that could have been explained away. And I think what you said earlier about sometimes someone who doesn't need to be at therapy can be caused more harm from being there in that therapeutic setting than help. Because for probably the last 5 years, a significant portion of time that I've spent getting mental health care was for a medical problem. No amount of talk therapy would have solved that.
And talk therapy, like, I don't know if you know this, but talk therapy as a cognitive behavioral modality only works for about 40% of the population.
Ooh.
EMDR, on the other hand, works for about 90% of the population.
Do you think that my little trick that I do with the kids, and my children, from the time they were itty bitty babies, because of EMDR and because I learned that bilateral stimulation, so like music that's stimulating one ear and then the other ear, and tapping and rapid eye movement were all parts of processing our trauma and emotion and could help us out. So when my daughter started having fits as a baby, I started tapping on either side of her back, or eventually I taught her to do this one. And I know this is a therapeutic technique, but we would also sing regulate, and I would alternate my head onto either ear while I was singing. So we rock this direction so that I'm getting one ear more and then the other ear more. And
did you know that rocking in and of
itself
itself is soothing?
It is. It is. But we eventually work to the point that my kids do it for themselves. And they sing, regulate, regulate, now it's time to regulate, regulate. And we sing that same verse with that same pattern over and over again. Is that modality?
Cognitive behavioral?
No. Was it EMDR or EDMR?
It's an aspect of EMDR.
An aspect of it.
It's a bilateral stimulation.
Mm-hmm.
If you wanted to go with what is it more of, I'd say it's more somatic experiencing.
Oh, okay.
Somatic experiencing is more body work.
Mm. See, I respond very well to that. I do. And at least one of my children does as well.
There's even touch therapies out there. I know some therapists in town that will, like, with your permission, touch you.
Interesting. We should talk about that on another episode. I have questions on that one.
Okay.
For sure. But we're getting close to time for the day. I think in summation from where we began this conversation, which is I think they should throw trauma out. We've pretty much we've stayed pretty close on topic here with this one, which is
I think they should leave it for insurance purposes and redefine it to be more accurate and whole body.
I think it should stay in the therapist office. I think they can redefine it for insurance purposes, but that it needs to be something that only a mental health clinician can diagnose.
That note, I don't know if you remember a couple years ago when the Health Information Exchange was brought to Oklahoma.
Yeah.
Mental health was excluded because we walked to the Capitol and marched and said, no, HIE is not for me, meaning not for mental health. And only Connecticut is the only state in the entire United States of America that includes mental health in their HIE. And so for Oklahoma to try that
define
nonsense,
HIE for
Health Information Exchange.
Health Information Exchange.
So your dentist doesn't need to know about your daddy issues.
No. You don't need to log into MyChart and your gynecologist can determine whether or not, those things should not cross over. And I don't know of many people that do not receive their first mental health diagnosis from a medical doctor. I think most mental health diagnoses come from a medical doctor. I don't know that should be for any of them. But I think specifically for trauma, you should have to do a trauma index and inventory. You should have to do some form of...
The PCL-5 is one of them. I don't know what it stands for, but there's a long form like Criterion A that goes through like...
It's like an ACE score, I think.
No, it's just like, have you ever been through this? Have you ever witnessed that? Has somebody in your life ever had this happen? And it's like a long list of like... abuse questions and like all this other sorts of types of questions.
I know there's a more simplified one of that.
That's
too.
the PCL-5.
Okay. I got you. So I think that you should have to do that to receive that kind of diagnosis. And I think any and all treatment surrounding trauma should be held in the mental health sphere and not at all in the medical sphere. And that's my unqualified opinion.
Respect. Yeah. All right. Well, thanks for joining us. I'm Katrina, licensed professional counselor, not your professional.
And I am Emily, Final Girl M, and I'm your final girl, and I'm going to survive and outlive and outlast. And so you better follow along, okay? We'll see you later.